family physicians have a unique outlook on pregnancy, prenatal care. Because we address most problems, most medical problems and issues with the idea that this person comes to us as part of a family, we're trained to have an outlook that we're going to be caring for them over an extended period of time.
I would describe the relationship like a family unit. You really put trust and care into the family doctor, and you're hoping that they'll guide you and also respect your wishes throughout the pregnancy.
Family doctors that do obstetrics are able to coordinate care among multiple allied health professionals and specialists to get the patient what she needs when she needs it in the setting that she needs it in, and still bring it all back to the patient and to the patient's medical home.
He hasn't let us down once. He's been amazing. We've had a couple issues here and there, and he's come through. He found something when we were in a certain point in the pregnancy, and not only did he catch it, he made special arrangements. He actually showed up at the hospital, so he was there in the day, he showed up in the night. It just goes to show what a great doctor he is and how he's come through.
After Heather gave birth, we had a bit of a hiccup. It was like a scene from Grey's Anatomy and everyone was running around. It was so scary. But my family doctor really stepped up. She took her skills and her knowledge, and it was almost like she went through a checklist to make sure that Heather was okay. And she really came up with a plan.
We're all ready to make those relationships. We work on them right from the beginning, and we build on them over the time that we have with that woman. We want to know where she's coming from.
Family physicians can provide unique care to patients in their pregnancy because our focus is patient-centered as well as family-centered. Many of us recognize in caring for families on a regular basis that we don't just need to consider the needs of the pregnant patient, but also that of the baby and sometimes the members of the family unit as well, whatever that may look like.
I've always battled with clinical depression, and it hit very hard with my son, my very first pregnancy. So for me, making sure that I did have the medical care, but there was also the other pieces that were part of it as well. If you're not looking at the mental health piece of pregnancy, it still has an effect on the child.
Family doctors are uniquely suited to manage all the elements of this patient's care as she goes through her pregnancy journey. These things may be medical, like diabetes care or arthritis care, or personal, like mental health issues or social issues.
For us, it's just part of that fluid care. We take women on early in pregnancy, we follow them throughout their pregnancy and into newborn care. It's foundational in our training.
I'd like to thank my family doctors for being real here. And there's nothing more real than pregnancy. They continue to be very accepting of my little fears or my big fears. They've seen me through some very real times. Knowing and having that relationship with them for one of the most important parts of your life helped.
I would like to thank our family doctor for the successful delivery of Michael and what he's going to do with this little one.
I'd like to thank family doctor for caring about my wife as much as I do, and almost having that initial love for my children that I get when they were born.